Riverside Methodist Hospital is a 1,058-bed tertiary care hospital member of Ohio Health, a not-for-profit, charitable, and nationally recognized family of 17 hospitals throughout a 40-county area. The pharmacy department estimated they were receiving about 400 calls per day from nursing, with 50% of those calls asking about where their medications were located in the distribution process and when they would be delivered. The department's obsolete inventory had reached a level of $250,000 annually. The Riverside Methodist Pharmacy has a track record of progressive thinking. Hospital pharmacies have been looking for something like this for years because the benefits run throughout the organization. Nurses can get their medications to patients more quickly, and it reduces wasteful reorders from communication breakdowns.
Riverside Methodist Hospital is a tertiary care facility located in Columbus, Ohio. The pharmacy department is a 24/7 operation. We run a hybrid distribution model. We do have a significant amount of automation in the pharmacy with the cart fill. With regards to clinical services, we have a clinical pharmacist stationed throughout the hospital, critical care, medicine, cardiology, and surgery. How did MedBoard come to be, and what is our viewpoint on MedBoard? We view MedBoard as the FedEx of the pharmacy world. It's a case where we're delivering medications, FedEx is delivering packages. We both have the same goal in mind, and that is to be able to track, what medication is delivered to the right place at the right time and who did it. Successes with MedBoard to date, we are tracking a significant number of indicators to document our success. We are looking at missing medication requests, we are looking at phone call volumes, we're looking at obsolete inventory, are three of the indicators that we're looking at. Data from July of 2009 to January of 2010, we've seen a 50% reduction in missing medication requests. Our phone call volumes have also dropped, as well as our obsolete inventory. We've seen a significant reduction in drug waste. We've seen a reduction in nursing calls. January of 2010, we've seen a 2,000 fewer calls than baseline pre-MedBoard. And so the correlation between MedBoard use and nursing calls, there is a correlation between the two. And from my assumptions, as well as my discussions with nursing leadership, there is a correlation that says that if we're delivering the medications and we're tracking where they're at, call volume is dropping. The clear message from nursing leadership is their goal is to increase the amount of time that a nurse spends at the bedside. And so if we are tracking medications and being able to efficiently and accurately deliver medications, the nurses are spending less time messaging pharmacy for missing doses, they're spending less time making phone calls to the pharmacy, and therefore they are spending more time with the patient at the bedside. Cost savings at this point in time are calculated and projected based upon the indicators that we've discussed of phone calls, missing meds, and obsolete inventory. We also have some additional operational improvements in efficiency. Dollar-wise, I haven't actually put an actual dollar on it. That wasn't our goal. Our goal was to improve the service and quality of the pharmacy operation. Phone calls into the pharmacy from nursing or otherwise, lead to interruptions of the pharmacists or the pharmacy technicians. And so our goal to reduce those phone calls is not only from an operational efficiency and a productivity standpoint, but also from a safety consideration, which is one of the reasons why we're trying to drive those calls down. MedBoard is allowing us to track the medications throughout the pharmacy as well as the hospital. So from an operational perspective, as calls come into the pharmacy, we're able to look up those medications and be able to give a definitive response to nursing. It does reduce frustration with regards to the pharmacy and nursing, and as we've discussed, we've seen some operational improvements in missing messages, phone calls, and obsolete inventory. In December of 2009, based upon our ability to tighter track the movement of medications as well as medication turnaround time, we were successful in having a discussion with senior leadership where we added 4 additional delivery technicians. for the purpose of improving our service with the trade-off that we can now show senior leadership as to what is the impact. Hospital administration is just starting to see the data that is coming out of MedBoard, and we just recently had a discussion with Vice President of Operations as well as Chief Nursing Officer, and the feedback was very positive. What we've been able to show is there's been a positive impact on obviously the pharmacy operation, while at the same time the nursing is seeing some positive benefits due to the operational impact of MedBoard.
Well, the first one probably is the fact that we can now actually measure from the time that we begin to process an order until it arrives at the nursing station or the patient care area. The second one is for us to understand the amount of work that is in the department that is being worked on, and so we can prioritize those doses in an appropriate manner. They can see an impact in terms of the turnaround being tracked and a decrease in the amount of time from the time they request it until they receive the dose. And then there's also the ability for them to see where that dose is in the process. The types of orders that we're focusing on are admixtures, first dose admixtures, as well as any NOWs or stats. And we want to track those from the time that the label prints and we begin working on it until they reach the patient care area. And that's accounting for about 300 to 350 doses a day.
MedBoard does track specific user actions within the application. Are we using it for that purpose today? No, but if questions come up as to medication was delivered, we now know who actually delivered it, so we are using it for that purpose. We are also using it from a safety perspective. Our medication safety pharmacist is able to quickly identify who was the pharmacist that was involved in the check. So instead of having to use a paper process and go back and look at work cards, today she can log into MedBoard and see who the pharmacist was. The reports within MedBoard at present day, the most valuable data point is to quickly get a turnaround time for current day, last week, last month, any specific period of time that you wish to have that. I go back to the days of 2002 when we were using paper and we were using an old time clock to capture turnaround time. And that was extremely manual, and it was time consuming to input the data and then to generate the reports. Today, at the end of the day, a report is run and I have a turnaround time instantaneously. Where we see MedBoard is, future state, all nurses within the hospital will have access to the application just like any end user would with FedEx. And so they will be able to track the movement of medications within the pharmacy. They'll be able to answer those questions. Well, has the pharmacist, checked the dose? Has it left the pharmacy? And where was it delivered? If you're looking to improve quality, service, reduce, waste, expenses, etc., it's something that you should at least evaluate.
Thank you for your interest in MedBoard. For more information, please call Pharmacy Onesource or go to our website.